Hi, this is Lauren from Team 3. Jeannie and I chose the National Kidney Disease Education Program to look at for our health communication analysis. The National Kidney Disease Education Program is part of the National Institutes of Health and was set up to help reduce disparities and improve care of patients with chronic kidney disease, which can progress to end-stage renal disease, which is when the kidneys no longer function. At this point, the patients have limited choices. They may choose to have a permanent dialysis placement, in which then they'll be on dialysis, which then takes anywhere from 3 to 4 days of a week out of their life. They can choose to be placed on the kidney transplant list, or they can choose to do nothing and wait to be placed in hospice. The National Kidney Education Program hopes that through education, they can prevent this progression. Through research, training to all providers, and best practices, they can give individuals with risk factors the tools to change this progression. Chronic kidney disease is a global public health concern and a key determinant of poor health outcomes. More than 20 million Americans aged 20 and older may have chronic kidney disease, and diagnosis is based on decreased glomerular filtration rate or an increased albuminuria, which is a sign of kidney damage. Recent data show that close to 600,000 Americans are on dialysis or living with a kidney transplant. Chronic kidney disease and end-stage renal disease impose tremendous public health burdens. In 2010, costs for Medicare patients with chronic kidney disease exceeded $40 billion, accounting for 17% of the public general Medicare cost. Early detection and appropriate treatment of chronic kidney disease may improve the prognosis. Although chronic kidney disease is common, many Americans with the two leading risk factors, diabetes and high blood pressure, do not know they are at risk. The rising prevalence of obesity and diabetes is driving an increase in the burden of chronic kidney disease, as well as cardiovascular disease, which is associated with chronic kidney disease. Through the control of blood pressure, diabetes, and with the use of medications to protect the kidney function, the progression of chronic kidney disease may be slowed down. Albuminuria is the earliest sign of chronic kidney disease. Increasing or elevated levels may indicate progression of chronic kidney disease. Assessing the urine albumin excretion yearly to diagnose and monitor kidney damage in patients with type 1 diabetes for 5 years or more, and with type 2 diabetes patients. Glomerular filtration rate is an estimate of kidney function that must be at a steady rate. It's only an estimate and is not an actual value. The estimates are based on populations, such as men, women, African American. A majority of diseases that cause kidney failure and related cardiovascular complications among adults have their origins in childhood. With the increasing amount of childhood obesity, there is an increase in the amount of pediatric chronic diseases and with diagnosed cases of chronic kidney disease in children. The National Kidney Disease Education Program aims to reduce morbidity and mortality associated with kidney disease by promoting evidence-based interventions to improve understanding, detection, and management of kidney disease by all involved in the patient care. They work to reduce the burden of chronic kidney disease, especially among communities that are most affected. disproportionately affects racial and ethnic minorities, particularly African American, Hispanics, and Native Americans. There is a higher percentage of undiagnosed chronic kidney disease in lower income communities due to a lack of follow-through on medical care and on the dietary choices. The National Kidney Disease Education Program uses the chronic care model to coordinate all patient and healthcare entities for the best patient outcomes. The goal is one of informed, engaged patients and communities, prepared and proactive healthcare providers, and efficient, effective healthcare systems. Best practice needs care that starts with a primary care provider. Most patients with chronic diseases are outsourced to specialists, but in the kidney disease education program, the primary care provider is given the tools to coordinate and maintain an interaction with the patient. It also focuses on raising the awareness of the patients at risk for the importance of early detection through testing. The Kidney Disease Education Program also does a lot of community outreach. Two other programs are the African American Outreach Program, which works through Family Reunion Initiative and Kidney Sundays. In Kidney Sundays, they actually go out to churches and do presentation, handouts, and discussion groups with patients to educate them on the importance of the early detection. In the Hispanic Outreach Program, they've made a significant gap in the Spanish language programming and materials that are needed for Hispanic and Latino audiences. All the materials are based on published evidence, have been reviewed by the practitioners and the experts, and they aim to convey accurate yet easy to understand information about chronic kidney disease. They also stress supporting self-management among the chronic kidney disease patients by giving them handouts that explain the basics of chronic kidney disease once they're diagnosed. They give them handouts that explain, all the medications they're on and the importance of staying on them and what each med does, and also about interactions with their pharmacist. They have nutrition tip sheets that focus on monitoring your sodium, your protein, your potassium, and how to read food labels. They actually have some videos where the patient and provider interactions, having discussions around chronic kidney disease questions. So this way the patient has an understanding of how to do an interaction and discussion with their primary care provider. With chronic kidney disease, it takes a village to help the patient survive. Through early detection and monitoring, patients with chronic diseases can limit the progression of kidney disease with the assistance of a collaborating team of medical providers. Thank you. That's our presentation.